Gain a deeper understanding of the nuances of MSK imaging across all life stages. Join RSNA in Lima, Peru, January 23rd through 24th for MSK a través de las edades de la pediatría a la geriatría. This 2-day bilingual course delivers interactive, hands-on learning to help you discover practical tools for the diagnosis and management of MSK conditions you can immediately apply to your clinical practice. Register today at rsna.org/spotlightlima. Welcome to the RSNA Radiographics podcast. I'm your co-host and assistant editor for the show, Dr. Refky Nicola from SUNY Upstate Medical Center. And today we are speaking to Dr. Sudhakar Venkatesh from Mayo Clinic in Rochester, Minnesota, about his recent article called Imaging Manifestations of Alcohol Use Associated Disorder and Diseases. Welcome to the podcast.
Thank you, Dr. Nicola.
It's nice to talk to you. I wanted to talk about this article because I thought it was very interesting. Can you explain to us why alcohol is very toxic to the body?
Yeah, thank you for your interest. Alcohol is a very widely consumed social drink. However, alcohol is metabolized to acetaldehyde, which is actually a toxic and carcinogenic compound. And this metabolite, along with the generation of multiple other reactive oxygen species, causes oxidative stress and inflammation. And most of the alcohol is metabolized in the liver, which is the primary site of alcohol metabolism, and therefore becomes extremely vulnerable. In addition to that, alcohol disrupts the gut barrier, which allowing the endotoxins to enter the bloodstream, which further exacerbates the systemic inflammation. So therefore, even small amounts of alcohol can become toxic, and also small amounts of alcohol can increase cancer risk.
I wanted to review some of the effects of the alcohol throughout the body, and I wanted to kind of start from head to toe. Can you explain to us what Wernicke's Korsakoff syndrome as well as Wernicke's encephalopathy is?
Yeah, Wernicke-Korsakoff syndrome actually results from thiamine deficiency. It is often secondary to chronic alcohol use. And Wernicke encephalopathy is actually the acute phase, and the Korsakoff syndrome is the chronic amnestic phase. So what happens in Wernicke-Korsakoff syndrome is secondary to thiamine deficiencies, changes occur, and patient usually presents with ataxia, global confusion, and in severe cases of thermoplegia. The imaging findings are typically found on MR, and which includes T2 hyperintensity and restricted diffusion in medial thalami, mammillary bodies, periaqueductal gray, and tectal plate. But these findings are not specific to Wernicke's encephalopathy, and the differential includes infectious encephalitis, Creutzfeldt-Jakob disease, ischemia, and deep cerebrovenous thrombosis. So really, it is the clinical association with the alcohol use that makes the diagnosis possible.
I see. What are some of the findings also associated with alcoholic dementia?
Yeah, alcoholic dementia is very well known, but however, the findings still remain a little bit controversial. It typically shows frontal lobe volume loss and cerebellar atrophy, which clinically manifests with dementia as well as ataxia. So, alcoholic dementia typically shows frontal volume loss and cerebellar atrophy, but this kind of overlaps with other kinds of dementia.
Can you talk to us? Are there specific findings related to alcohol withdrawal that are seen on CT or MR?
There are some findings which are supposed to be very characteristic, such as because alcohol withdrawal usually causes seizures and hallucinations, with that's being the clinical presentation. When you do an MRI in this acute phase, it can show cytotoxic edema and volume loss in both the temporal lobes, and it typically occurs in acute and subacute phases. Again, as I mentioned earlier, association with the alcohol use, acute presentation, and MR findings will clinch the diagnosis of alcohol withdrawal.
So let's talk about the liver. What are some of the acute and chronic findings associated with alcoholic liver disease?
So as I mentioned earlier, so alcohol typically affects liver the most because most 90% of the alcohol is metabolized in liver. So liver is becomes the primary target organ for all the effects. And the most common cause changes which occur in the liver secondary to alcohol use is now fatty change. but it can also cause acute hepatitis. And as this steatosis or the fatty change which can occur in the liver associated with the inflammation can set up what is known as alcoholic steatohepatitis. Now, if this is not intervened in between, in the sense that the patient continues to drink alcohol, especially heavy drinking or binge alcohol drinking, can lead to fibrosis and then leads on to cirrhosis, which can be, it looks typically like any other cirrhotic liver. But the association again is with the alcohol use and the presence of no other chronic liver disease etiologies or the risk factors.
You mentioned in the article about the role of MR elastography. Can you talk about that with regards to alcoholic liver disease?
MR elastography is currently the most accurate non-invasive technique for diagnosis as well as staging of the MR of the liver fibrosis. So, similar to other chronic liver diseases, as the fibrosis increases in the liver, the stiffness of the liver increases, and this can be non-invasively detected by elastography techniques. MR elastography is particularly useful because we can also look at the fatty change as well as the increased stiffness, which is deflective of fibrosis. So, MR elastography, along with the other MRI sequences for detecting hepatic steatosis, is very useful. And in fact, it is the most accurate technique for diagnosing non-invasively the liver fibrosis.
What are some of the radiological findings of hepatic encephalopathy?
So the hepatic encephalopathy is usually seen in later stages of or chronic alcohol use, and this usually it can present also as an acute finding or an acute presentation. And an acute presentation, if you do an MRI, you can see hyperintensity on the T2 weighted images in the cortex and the corticospinal tract. You can also see restricted diffusion in insula and cingulate virus. And this is typically different from Wernicke encephalopathy. And then in chronic cases, because of the deposition of multiple substances, and manganese is supposed to be one which gets deposited in the basal ganglia, particularly globus pallidus, substantia nigra, and subthalamic nuclei, and then these can be seen as hyperintense regions on the T1 weighted images. And that's very characteristic of hepatic encephalopathy. And this is typically seen in patients who have chronic alcohol use disorder.
I want to move on to the cardiac and pulmonary manifestations. Can you talk to us about some of the cardiac and pulmonary manifestations of alcohol use disorder?
Yeah, thanks for that question again. Yeah, it's a kind of a controversial thing because some of the cardiology articles and journals or the journal editorials do mention that alcohol is cardioprotective. But in generally speaking, alcohol is not considered cardioprotective, and it is so can cause what is known as alcoholic cardiomyopathy. And this alcoholic cardiomyopathy, if you do an MRI or the CT scan, you can see left ventricular dilatation and dysfunction. And if you're doing MRI with gadolinium, you can see late gadolinium enhancement in the ventricle, but it in a non-ischemic pattern. And also sometimes you can see increased T1 signal in the myocardium secondary to fat deposition. So this is typically seen in chronic alcoholic cardiomyopathy. The acute effects of alcohol can also be seen as atrial fibrillation, which can occur and can give rise to what is called as the holiday heart syndrome. And that can also see pulmonary manifestations are usually secondary to aspiration and increased risk of infection due to immunosuppression. So patients who have alcohol use disorder become intoxicated are at risk of aspiration pneumonia. And then because of the immunosuppression and aspiration pneumonia, second, they can are at high risk of developing acute respiratory distress syndrome. And finally, because of the liver failure and chronic, including portal hypertension, they can manifest with hepatopulmonary syndrome, which is typically characterized by low oxygen content in the blood or low arterial oxygenation, despite a patient breathing 100% oxygen in the room.
I wanted to move on now to some of the musculoskeletal manifestations. Can you talk to us about how they affect the musculoskeletal system?
Thanks again. This is probably the most unrecognized effects of alcohol. Alcohol is associated with myopathy, osteoporosis, increased risk of fractures, and osteonecrosis. So we don't know the exact etiopathogenesis, pathogenesis of this effects on muscle. It is known to cause non-alcoholic myopathy, which is usually seen as edematous muscles in the acute phase, and in the chronic phase, it may be replaced by fatty atrophy or fat infiltration in the muscle. And increased fracture risk is secondary to osteoporosis, and this may be multifactorial, secondary to vitamin D deficiency, as well as reduced intake. And fractures are very common because of falls, again, secondary to effects on brain, as well as because of osteoporosis. And osteonecrosis, in fact, the second most common cause after steroids for a non-traumatic cause of avascular necrosis of the femur, and this can include use both femurs. And MRI typically shows the double line sign as a hypointense line in subchondral regions, characteristic of osteonecrosis. And often these patients who have myopathy also manifest with peripheral neuropathy, which is also under-recognized secondary to alcohol.
Tell us about the traumatic injuries associated with alcohol use disorder.
The traumatic injuries are almost directly associated with the effects on the brain as well as any intoxication. So, most of the time, when the patients have this trauma secondary to alcohol, it is because of loss of inhibition and loss of protective mechanisms. So, as a result of which, these patients tend to fall directly on their head or on their face, which normally another non inebriated or a non intoxicated person would normally avoid getting hit on the head or the face. So, as a result of which, patients who get injured with alcohol use disorders commonly come with head injuries, facial fractures, extremity traumas, and sometimes blunt abdominal trauma. But at the same time, when they have these kind of injuries, they also are at a higher risk of post traumatic infections because of the immunosuppression associated with alcohol.
You mentioned in your article that alcohol is considered a carcinogenic by the World Health Organization. Tell us how its effect and the process by its carcinogenic effects.
Alcohol is considered a group 1 carcinogen. A group 1 carcinogen meaning it is a known risk factor for development of carcinomas. Both alcohol and its first toxic metabolite acetaldehyde are listed as group 1 carcinogens by the International Agency for Research on Cancer. So, alcohol, by its dehydrating effects, causes irritation in the mucosa, as well as associated with poor oral hygiene, increases the risk in oropharyngeal cancers. And as the alcohol travels down in the esophagus and the stomach, it can also cause a lot of irritation, gastroesophageal reflux, and can predispose for patients to develop esophageal carcinoma. So once in the system, the acetaldehyde, when it is produced, it's actually a very toxic and carcinogenic compound. It actually causes DNA adducts, and these are DNA adducts carries this mutagenic risk and increases the possibility of developing cancers. So the best known cancers which are linked to the alcohol use is actually liver, and surprisingly, a lot of people won't know is breast. Risk of breast carcinoma is associated with alcohol use disorder, and also colon and rectum, and as I mentioned earlier, oropharynx and esophagus because of the irritation. However, even a small amount of alcohol increases cancer risk, and there is no amount of alcohol in which there is no defined amount which can increase the risk of alcohol. Any amount of alcohol can increase the risk of cancer.
Well, thank you very much, Dr. Sudhakar Venkatesh. That was a really interesting discussion about the effects of alcohol throughout the body. You can read the entire article in the July 2025 edition of the Radiographics Journal.
Thank you very much for having me.
Thank you. It was a pleasure.